Hello, my name is Andrew Kolsky, and I work at stopmyocd.com. Today, I want to talk to you about the OCD process. It can become confusing when we struggle with obsessive thoughts that we respond to with compulsions. We don't know what's happening. We don't know why it's happening. And all we know is that we want it to stop. So the first step in dealing with OCD is to understand how it works. So let's take a look at the OCD process today. First, we have the here and the now. And in the here and the now, there's two things that occur when it comes to OCD. The first thing is we have a trigger. A trigger is the thing that starts us thinking about something related to an obsession. When that trigger hits, we get an obsessive thought. Some people have one particular obsessive thought, like perhaps I've touched doorknobs, so I must be contaminated. Other people can have multiple different types of obsessive thoughts. OCD doesn't discriminate. It can be anything. Once we leave the here and now, we go over into what I like to call the OCD cycle. And please notice that I have this in a separate color box because it's separate from the here and now. And I'll describe that in a minute. But let's look at what exactly happens in the OCD cycle. Well, the first thing that happens is we start to get obsessive doubt. Now, doubt is when we have the facts in front of us and we just don't believe them. When we have that obsessive doubt, it starts the rest of this cycle and it continues and continues because it is a loop. So the second thing that happens when we get the obsessive doubt is we start to think about the consequences. So if the obsessive doubt is my hands must be dirty and they must be contaminated. So if I don't wash them and get rid of that contamination, I might get home and spread it all over my kitchen, in my house, and my bedroom, and my bathroom. And then it's going to be there to be spread even further by myself and by other people. And these consequences could end up making me sick, or perhaps even making me so sick that I end up hospitalized or die. So the consequences come from the obsessive doubt. Once we think about the consequences, the next thing that happens is we feel distress. The distress is all of the different things, such as the sweaty palms or the racing heart or whatever it may be. Some people go to the point that they even have panic attacks because the distress can be so difficult to deal with. As a result of this distress, what do we want to do? Well, we want to get rid of the distress, of course. So what do? We do compulsions. Compulsions are the things that we do that allow us to temporarily alleviate the feeling of distress that we get from our obsessive doubts. So in the case that I'm describing, a compulsion may be that I go and I wash my hands. The problem with compulsions is that they are only temporary. With a compulsive action, I wash my hands and I feel better. And then soon thereafter, because I'm in this green box in the OCD cycle part of it, I might get this thought of, well, yeah, I washed my hands, but I wonder if I really got all the germs. I better go back and wash them again. And then you can see how the cycle takes over, because from there, the obsessive doubt continues to raise questions. It makes us think about the consequences. That raises our distress. We do the compulsion to lower it, and then we go back again. So as you can see, this is a loop. So the interesting part here is that you'll notice that loop happens over in the OCD cycle, but it doesn't happen in the here and now part of reality. So how do we treat OCD? What goes on? Well, a couple things go on when we're looking to treat OCD. The first thing is what you probably heard of as exposure and response prevention therapy, sometimes exposure and ritual prevention. And what that is we do exposures to the things that cause you the obsessive doubt. And instead of allowing you to do your compulsion, we don't do the compulsion and we focus on the distress. And that distress can go higher, but eventually, in most cases, it then starts to go lower as you learn that you can handle and tolerate your distress and that it's not as bad as you think it might be. So in ERP, we focus on distress and the compulsion. And you'll notice that's at the back end of the entire cycle, right? But that has been the gold standard for a very long time, and it can be very effective. I've had many clients who have gone through ERP, and in a very short time, they've gone from a very high level of distress down to not really being bothered at all by the situation. So ERP is probably the most common therapy used when someone is dealing with OCD. But it's not the only thing. I do have many clients who, for whatever reason, we're unable to trigger the distress or raise the distress to a level that it will be effective to do the therapy. And that's okay. There's other things we can do too, because at Center for Professional Counseling and Stop My OCD, we focus heavily on keeping up with the most up-to-date science and treatment methodologies related to OCD. So we don't have just one thing we can do. We analyze your specific case and we design a treatment program that is specific to your particular needs. Treatment programs can include ERP. In a minute, I'm going to talk about something else called IBT. There's medication, and then there's other things for the small number of clients who don't benefit from those. But let's continue here. So we've talked about exposure and response prevention. And if that's something that is not effective, then what we do is IBT, or perhaps we start with IBT. It depends on the particular case. We might even do a hybrid of both. But what is IBT? IBT is inference-based therapy. And you notice the little red arrow there, actually the big red arrow, and it focused on obsessive thoughts and then obsessive doubt. And it's important to understand that there's a little chasm between the here and now and then the OCD cycle. And the reason for that is because when clients stay in the here and now, and they don't start the process by getting into the obsessive doubt, so they can have the obsessive thought, and that's fine. But when they let themselves slide into the obsessive doubt, that automatically takes them into that OCD cycle that is so hard to get out of. So through treatment, we talk about exactly what are obsessive thoughts, how are they different from obsessive doubts, how do we know when we're seeing one or the other, how do we avoid getting into the situation where we get into obsessive doubt. That's all a part of the treatment process. So IBT is another option, and it's important that you have a therapist and a doctor who understand OCD and who have experience in treating OCD. Too many times I've seen patients come in who have been misdiagnosed for years and they struggle for no good reason other than they were misdiagnosed. So at Stop My OCD, if you look at the bottom of our slide here, we have a free support group where anyone is welcome to come. You simply sign up at stopmyocd.com and you will receive notifications and information on how to join the support group. There's no cost, there's no obligation, but people who come learn a lot about their situation. And this support group is open not only to individuals with OCD, but for family members and loved ones as well, because they're also affected by OCD and they don't know how to handle it. So I want to thank you for taking the time to learn more about the OCD process. I hope to see you at our support group. And again, my name is Andrew Kolsky, stopmyocd.com.